Our e-cigarette speaker is Dr. Peggy Lambert-Fink, Associate Professor in the Nursing Department at the West Virginia Institute of Technology.
All right, thank you, Donald. I'd like to tell you who I am. By way of background, I'm a family nurse practitioner. I've been a family nurse practitioner for the last 18 years. And what I intend to cover in this segment will include background about e-cigarettes, an overview, and the health effects of the use of e-cigarettes. The smoking rate in the United States has been slowly declining, but various alternative tobacco and nicotine delivery systems have been gaining in popularity. Electronic cigarettes are the most commonly used tobacco products among youth in the United States, exceeding the conventional cigarettes in 2014, growing 900% among high school students from 2011 to 2015. E-cigarettes are increasing in sales and popularity with youth and young adults for many reasons. They're marketed as relatively safe. There is a huge variety to choose from with more than 466 brands, more than 7,700 flavors, and they're manufactured in various forms and sizes. Because e-cigarettes are perceived as safer and promoted as such by manufacturers and retailers, the public may not realize the risks that are involved in using electronic cigarettes. Due to lack of regulation, the consumer has no idea of what they're buying when they purchase e-cigarettes. The contents in the different brands vary from manufacturer to manufacturer. But as of August of 2016, the FDA has plans to structure the regulation and the manufacturing of e-cigarettes with required registration and a 2-year application process. Because of the oversight, there should be greater consistency in the product, and that will create an opportunity to better research the long-term effects of electronic cigarette use. Electronic cigarettes have been for sale in the United States since 2007, but the sale has surged in recent years. It's a $3.5 billion market, and in 2014 alone, there was $125 million spent on advertising. Electronic cigarettes are battery-operated devices that heat a liquid into an aerosol that the user inhales. These items often resemble cigarettes, cigars, pipes, and they deliver a nicotine-containing aerosol, not just water vapor that looks like tobacco smoke. Electronic cigarettes have many names that include vapor cigarettes, ENDS, which are electronic nicotine delivery systems, E-Cigs, Cig-a-likes, vape pens or vapes, e-hookahs, mods, or tank systems. And while there is no tobacco in the e-cigarettes, the liquid has nicotine, which is a highly addictive drug. It has flavorings and other additives in various amounts. Are they harmful? E-cigarettes contain solvents, flavorants, toxicants, lead, cadmium, nickel, tin, and other metals which can cause nervous system and respiratory problems. There is a public perception of being safer than tobacco products and even a method of tobacco cessation, promoted and encouraged by some politicians, manufacturers, and retailers. Just look at the headlines that the public sees with the message that vaping is over 80% cheaper and 95% safer than smoking. That's what they remember, but that's what we need to educate the public about. Because electronic cigarettes have been unregulated, the health effects on users and of secondhand exposure to non-users is only partially documented at this time. Research is underway to determine the damage that vaping is causing. Ingredients can vary with manufacturer. Nicotine may range from 0 to 72 milligrams per milliliter of liquid. Traditional cigarettes have about 10 to 20 milligrams per pack. In addition to nicotine, propylene glycol is present and when heated can degrade into formaldehyde. Formaldehyde may be familiar to you as a body preservative when people die, and it's also linked to nose and eye irritation and is linked to an increased risk of asthma and cancer in the living. Recent tests on 97 e-cigarette products resulted in acetaldehyde, a class 1 carcinogen which can cause cancer in more than half the brands. Benzene, which is found in car exhausts, and toxic metal nanoparticles are produced when vaping. The heating, vaporization, and inhalation of flavoring chemicals can create an exposure pathway that can result in obliterative bronchiolitis, a serious lung disease that is only curable by a lung transplant. Diacetyl is a butter-flavored chemical that can cause serious and irreversible lung disease called popcorn lung. Some flavorings, such as those used to create cinnamon flavor, can be toxic. And until recently, there were no measures to confirm purity or safety. As of August 2016, the FDA will oversee regulation where there's potential for product consistency. This consistency may allow us to explore more fully the repercussions of e-cigarette use. There are more than 7,700 flavors to appeal to younger people, and these products do not contain warnings. There are more than 85% of e-cigarette users between the ages of 12 and 17 that use flavored cigarettes, and flavors are the leading reason for youth use. Research indicates that smokers who supplement cigarette smoking with e-cigarettes are less likely to quit smoking. Seems contradictory to what we think, that it might help them to quit, but in reality, they're less likely to quit. Because the vials are not childproof, there is a potential for overdosing, and many cases of accidental poisoning of young children have been reported to the poison control centers. Nationwide, there's been more than 3,000 cases of accidental overdosing. The devices are also very convenient for inhaling illicit drugs. There's fire hazard from the batteries, that several fires have been reported, possibly from the lithium batteries, but most have involved connecting to USB ports where the device is charged. And you can find on YouTube or on the internet many cases of spontaneous fires occurring from the batteries. In December 2016, the U.S. Surgeon General proposed a call to action through, quote, cost-effective, evidence-based, life-saving strategies now to prevent the youth of our country from trying tobacco and reducing the number of youth who move from experimenting to regular use. Product advertising targets young people with marketing strategies designed to appeal that include sexual content, customer satisfaction, varieties of colors and flavors, using television, point of sale, magazines, promotional activities, radio, and the internet. Teens who use electronic cigarettes are more likely to become heavy users with the likelihood of addiction and a lifetime of health problems. Research shows that those starting use of electronic cigarettes by 9th grade are more likely than others to start smoking or use smokable products in the next year. The brain is the last organ in the human body to develop fully, continuing until the early to mid-20s. Nicotine exposure during periods of brain development can disrupt the growth of brain circuits that control attention, impulse control, learning, mood disorders, and prime the brain for addiction to other drugs such as cocaine and methamphetamines. Adolescents who are addicted early in life suffer results of altered brain development and lasting cognitive and behavioral impairments, including problems with memory and attention. And we see many of those same problems in our public school systems. With pregnant women, this is a population dear to my heart, the nicotine effects on a developing fetus have lasting consequences on the fetal brain and lungs. It also is related to low birth weight, preterm delivery, sudden infant death syndrome, and stillbirth. According to the National Institute of Health, smokers currently experience 480,000 premature fetal deaths. 1 in 5 deaths annually occur with smokers, and an additional 16 million people suffering from serious illness caused by tobacco use. And because of the fire hazard risk and potential from devices, e-cigarettes are not permitted on airplanes in the United States. I think we can safely say that e-cigarettes are not harmless. In the United States in 2015, more than 3 million middle and high school students used e-cigarettes in the previous month. The profile we have of the users, most common users are males, whites, Hispanics, and those with less education. Electronic cigarettes are often promoted by manufacturers and retailers as a cessation aid. However, the FDA has said there is no evidence that they are appropriate as a tobacco cessation device. Some have thought e-cigarettes may lower cravings. However, studies of effectiveness have not shown this to be so. In fact, there are indications that electronic cigarettes can actually perpetuate the addiction in youth and young adults and can interfere with quitting. Another study found teens who smoked and vaped tended to smoke more conventional cigarettes than those who smoked but did not use electronic cigarettes. As shown in this CDC map, West Virginia continues to have one of the highest rates of tobacco use in the United States of more than 26%. In 2014, the first baseline data collection of electronic cigarette usage was conducted in West Virginia. This slide shows e-cigarette use among United States students. The gray line shows high school students from 2011 to 2015. The orange line for the same period shows middle school students, and the white line shows the average of all students, and you can see how the use has grown. About 1 in 5 adults reported having tried e-cigarettes. However, 1 in 6 high school students have used e-cigarettes in the last month. According to the 2014 tobacco survey data, 95% of the respondents reported knowing about e-cigarettes, so the knowledge is out there. These statistics show that adults from 18 to 34, look at the range, more than 1/3 have tried e-cigarettes, with senior citizens only having 8.8% haven't tried an e-cigarette. So it's a product used by young adults. When you look at the data for 2014 and compare smokers and non-smokers who tried e-cigarettes, 61% of those were smokers. 16.5% of those were former smokers, and those who never smoked, 5.6% of those wanted to try e-cigarettes. In 2014, in the West Virginia data, 31% of smokers reported using e-cigarettes during recent attempts to quit. According to the data from 2014, the profile of persons with the highest rate of trying e-cigarettes were adults with the lowest education and the lowest incomes. From the American Lung Association, specific goals for e-cigarette use, we want to point out that all of these points are important. I encourage you and challenge you to look at number 7, where we want you to take your educational initiatives that target youth and young adults and use your assessment and educational interventions to reach this population to try to make a difference. In summary, we've talked a lot about electronic cigarettes, and I'd like you to keep in mind, and I want to challenge all of you as healthcare providers, that you assess every patient at every encounter about tobacco use, but don't overlook electronic cigarettes. They do count as a tobacco product because they do contain nicotine. Be sure that you include your provider resources that include printed materials. There are printed materials that cover e-cigarettes. Ask, get some of those available for your patients. Counseling options, don't overlook those in the quit line and medications. E-cigarettes are not a medication for tobacco cessation. They are a nicotine product. Ask every patient at every encounter when they have tried to quit how they're doing. Become an educator about e-cigarettes, not just to the users, but make all your patients aware of the dangers. They may have relatives that use, and you want to reach them through your patients. And become an advocate for tobacco cessation.
Thank you, Dr. Fink. That was a very informative section on the emerging field of electronic cigarettes.